Today, I'm going to share with you my 15-year medical journey. I'm Dr. Ammon Hills. I'm a pain management doctor at Alpine Orthopedics in northern Utah. My purpose as a doctor is to relieve all types of pain and to help restore function into people's lives so that they can get back to doing the things that they love to do. All right, so let's get into it. I never thought that I would end up doing as much school as I've done coming out of high school. I initially wanted to design motorcycles. I went into mechanical engineering and finished all the math for that, did all my calculus, but I just didn't love the mechanical engineering field. So after mechanical engineering, I decided to switch majors to accounting. My dad owns a construction company, so I thought I'd go into the family business. So growing up, I did a lot of construction jobs. I was really familiar with the family business, but wasn't something that I really loved and kind of just wanted to turn my own stone. So changed my major third time's the charm. So I changed to exercise and sports science, which stuck and is what I graduated in. After I switched to exercise and sports science major is when I really started preparing for medical school. I soon found out that preparing for medical school was a lot of work, and I had a lot of work to do. Medical school isn't just about getting good grades, it's a lot of extracurricular involvement as well to become a competitive candidate. Some of the things that I ended up doing to help my chances was I did some volunteering. So I volunteered at a program called UFIT, which helped autistic children. I did that with my wife, which was lots of fun. I also was a Spanish interpreter at Primary Children's Hospital, which wasn't easy. Learning medical Spanish was a lot different than what I was used to. I also volunteered at a research lab at the University of Utah, where I was able to learn a lot, but also gain some valuable experience. So I had all these extracurricular activities, and then came the dreaded MCAT. I got my first taste of a really long standardized testing, which was prevalent throughout my medical journey. Little did I know, after the MCAT, I would have other tests, a step 1 test, a step 2 test, a step 2 patient encounter test, a step 3 test, and then residency board exams after that. And so a lot of board exams, a lot of long hours spent testing, taking very expensive tests. After taking the test, I thought I'd further kind of supplement my application and decided to do a master's degree at Midwestern University in biomedical sciences. As I was finishing up my master's degree at Midwestern, I started interviewing for medical school. I probably applied to over a dozen schools, interviewed at several different schools, and ended up getting into Kirksville, Missouri, A.T. Still University. I absolutely loved my medical school. So Kirksville College of Osteopathic Medicine is in a small town, and I'm talking small town. My medical school was the first osteopathic medical school, founded in 1892 by A.T. Still. If you're unsure what osteopathic medical school is, it's 2 types of doctors, MD and DO medical doctors. And osteopathic medical schools are the DOs. Another doctor that does YouTube that you may be more familiar with that's also an osteopathic doctor is Dr. Mike, who's also a DO. So medical school was 4 years, and the first 2 years was spent in Kirksville doing classwork and lots of testing. So much classwork and looking at textbooks. I remember my eyes, I wear contacts. My eyes were stable for many years, but after medical school, for all that close-up studying, my eyes actually got worse. Because Kirksville is a small town, I was able to do my clinical rotations, which took place the 3rd and 4th years of medical school somewhere else. So for the 3rd and 4th years of medical school, I picked up my family, my wife and 2 children, and moved across the country to Utah, where I finished the 3rd and 4th years of medical school. Interestingly, I actually rotated with some of the doctors with Alpine Orthopedics, which is the group that I'm currently working for, who actually recruited me back to work with them afterwards. So you just never know where life's gonna take you. During medical school, you have a short time period to decide which specialty you want to pursue, which is not easy. I was kind of torn in between a few different specialties. I was looking at emergency medicine, orthopedic surgery, as well as physical medicine and rehab. After getting a taste of all those different specialties and doing a rotation in physical medicine and rehab, I knew that was the one that I wanted to pursue for residency. Well, physical medicine and rehab is a pretty broad medical specialty that covers quite a bit. It ranges anything from sports medicine and kind of musculoskeletal injuries and problems to traumatic brain injuries, stroke, take care of amputees. So pretty broad specialty, which gave me a great experience. So I ended up applying for a residency in physical medicine and rehab. So there's certain residencies that require an internship year that you have to complete before you actually get into that residency. And so that's true for the one that I did with physical medicine and rehab. I first had to do an intern year. So I had to end up applying to both intern year programs as well as residency programs, which ended up being a couple dozen. After applying to a bunch of different programs, I interviewed at approximately 6 internship programs and maybe 8 pm&r programs. So after applying and interviewing at all these different programs, it all comes down to the match process. The match is where you have to rank your top programs, and all the programs rank their top applicants, and then there's a day where we find out where we end up. I was really excited about the match day, and I was able to match into the intern year program that I wanted. I went to IU Health Ball Memorial Hospital in Muncie, Indiana. I was one of the first osteopathic doctors to get accepted into that program, paving the way for some other osteopathic doctors to get in, which came after me. I was really excited to match into that program because it had a great lifestyle and a well-balanced program. And also on match day, I also found out where I matched for residency. So I ended up matching to UT Southwestern program in Dallas, Texas. So after finishing my 1-year intern program, we moved, packed up the family once again, this time with 3 children, and moved to Dallas, Texas. So residency at UT Southwestern was 3 years and was a great experience. One of the things that Dallas was famous for was JFK was actually assassinated in Dallas and was taken to Parkland Hospital, which was one of the hospitals that we worked at. When I first got there, they had just completed their new Parkland Hospital. It's a community hospital. I was during that first class where we transitioned from the old Parkland Hospital to the new Parkland Hospital. One of the things I really wanted in residency was to be part of a really large, diverse population. And that's exactly what I got in Dallas. A lot of interesting cases. We'd see a lot of different types of patients. It was a level 1 trauma center, so we would see all sorts of people coming in for either, gunshot wounds, traumatic brain injuries, strokes, even burn victims. We got a little bit of everything. Dallas gave me the opportunity to gain in leadership skills, so I was able to be a chief resident. So my chief resident experience was probably a little bit different from what you're familiar with if you watch like Grey's Anatomy.
I am your chief resident.
So I was in charge of setting up lectures, giving reminders, doing journal clubs, and just helping to guide the younger residents. Loved my time in Dallas, but knew my journey wasn't quite done. During residency, I decided I wanted to further my education and apply for a fellowship in pain management. So I was able to apply for yet another match for a fellowship position in pain management, and I was very, very happy to find out that I matched to the UC Davis program in Sacramento, California. I learned a great deal about pain management. I had a lot of great mentors there. While there, I was able to hone my skills a little bit more with ultrasound, as well as learn many more procedures that I do with the X-ray machine. While I was completing my training in pain management at UC Davis, I was contacted by that group, Alpine Orthopedics from medical school, who wanted me to come interview with them to see if I'd be interested in joining the group. It was nice because I was already familiar with the group and familiar with a lot of the guys in the group and felt like it'd be a really good fit. So after interviewing with the group and discussing with some of the partners, we both felt like it would be a good fit and decided to move forward. So that's how I got here today. Been working here at Alpine Orthopedics for about 6 months now. Really enjoy what I do and happy to be here. So if you like this video and want to see more, go ahead and click this video right here. And I'll see you guys next time.